for tonight. Lee is a very experienced nutritionist and also a health consultant, and also our contract speaker. So, Mr. Lee, take it away.
Okay, I take over. Okay, so good
Okay.
evening, brother and sister in this Vantros Healing Ministry. So tonight we'll continue again with this topic on the prostate problems. So Wednesday we have gone through the Chinese version. So today we are going to talk in English, and then for I think next week. Okay, next week, maybe I will only take part in one section because company want to introduce something new in the Friday. So I will give talk on Wednesday only. So maybe 1 week in Chinese and 1 week in English. Okay, so maybe later on we'll have some changes again. So tonight, okay, we concentrate on this topic on the prostate problems. So far, I understand that a lot of people might heard about this prostate, and then maybe some of your family member, especially in Ventros, because uh, there are so many agent in Ventros are ladies. Okay, so uh, their family member who are men maybe would face the problem of prostate, especially for those who enter into a certain age of 50 and some even though some may start from the early 40, they may have some problem on this prostate and then symptoms are already coming out, but mostly a lot of men, okay, they don't like to tell about these prostate problems in front of the family members, especially their wife or their daughters or those. And then normally they will quietly ask their friends only, and then from the limited knowledge they have to look into this prostate, and then try to overcome the problem with their own method lah. Okay, some might will go for a checking with the doctor, some maybe not, some maybe will go for alternative medicine, and then sometimes they might even don't know that they are having this kind of problems, and the symptom is keep on uh, uh, exist and then make them uh, facing a lot of problem, okay, facing a lot of uh, difficulties and affecting the quality of their life, okay, without knowing that they are actually having these prostate problems. Okay, so even a man so far in the process of getting some information regarding prostate, I also did ask some of my friends or some elders or around me regarding this prostate, and then I discovered that most of the people they don't know actually the function of the prostate, the location of the prostate. They only know that the prostate will affect the urination problem. Okay, difficult to urine. That's all. Okay, other than that, they don't know much about the function, and then uh, uh, what is the use, okay, of prostate in our body. Okay, and after I go for a lot of checking, okay, and then a lot of survey study also show that there are so many men, okay, so many people, even though they heard about prostate before, but they also don't really know what is the function of prostate. Okay, and then they have mistakenly wrongly thought that the prostate's location is in a higher, okay, position or near the abdomen side. which is not the right position. Okay, so far here, when we talk about prostate, okay, prostate actually is a gland. Okay, earlier we have studied a lot, talked a lot on this hormone release. Okay, and then prostate is a gland, okay, which will release a lot of hormone also. Okay, especially the semen, okay, of the man. Okay, the sperm will mix with the semen. Okay, and then during this intercourse process, okay, the ejaculate, how we call ejaculation, okay, with the semen and the sperm will go, okay, and then the sperm coming out and then go into the vagina there. Okay, so in between the sperm is produced by the testicle. Okay, then there will be a tube will go, and then it will go through the what the gland also, okay, what we call the prostate gland also. And then our the most important thing, our bladder, okay, which control the urine. There will be a tube will go through the gland. Okay, it is covered by the gland, and then the gland inside a lot of tissue, the gland tissue inside there, which will produce a lot of semen. Okay, and then it will combine with the sperm. Okay, and then when having intercourse, okay, the sperm and the semen will ejected out, and then the process of reproductive of human will begin. Okay, so the tube, there's a tube from this testicle there. We call the what we call this is called the name of the seminal whisker will directly go into this prostate gland also, and then inside there finally it will join with the urine, the tube from the bladder. So the prostate gland actually can control the flow of the urine, because the contraction of the muscle near the this prostate gland will stop the urine passing through, those urine from the bladder there from passing through and go to the urine ureter of the penis to eject the urine. Okay, so in between there is a joint, this seminal whisker and the urine, the ureter there will join together, and then the control of the prostate gland. Normally, you urine of flowing when there is ejection of a sperm, okay, and then semen through the penis, so that the urine and then the sperm it won't join together when it ejected out from the penis. Okay, so this is how it function. So normally when a man, okay, having sex, and after the ejection of the this sperm and the semen, you feel want to go for urine, because during that time, okay, the prostate have to tighten up, okay, to disallow the urine to pass through, so that the sperm and the semen can be ejected strongly, okay, through the penis, okay, to the vagina, and then the function of the prostate part of it is to produce those semen, and then some of the fluid inside there, okay, and then some of the what we call the nutrient, and then the hormone, so that to allow the sperm to be more active, and then to provide food for the sperm to hold, okay, when they enter the vagina. Okay, so the fluid inside here will be slightly alkaline, and then so that to allow the activity or inside the vagina, which is very quite acidic one. So it will neutralize the environment so that the sperm can live longer, and then the process of uh, chasing for the eggs in the uterus there can be achieved, and then the sperm can be more active. So it will seriously affect the reproductive process, because if the release of all kinds of semen and then the hormone inside this prostate is not that good, okay, then the sperm cannot live that long, okay, and then the nutrient provide for the sperm is that high. So when the sperm enter into the uterus of the okay, the environment is not suitable for the sperm to live, then the process of meeting her eggs got to achieve, and then reproductive action process cannot be done successfully, and then of course growing of a kids is impossible. Okay, fertility is difficult to happen in the ladies uterus there. Okay, so this the basic function of prostate gland, which sometimes we don't know actually is produced by this gland. Okay, not only to stop the urine, okay, to control the flow of the urine, but also okay, to produce all the semen, which is very important for the sperm to live, okay, and then to lubricant the environment of the vagina, okay, when the sperm meet the eggs, so the possibility of having fertilizer and then giving birth, okay, making a baby is possible in the uterus. The better vaginal environment have to be helped by all the liquid produced, okay, by your prostate. Okay, so sometimes if prostate problem, okay, either because of the release of hormone, okay, or okay the cells inside here may not working properly, or sometimes may grow and enlarge, okay, and then it bring a lot of problem to our body, especially for those elders. Okay, they normally will face a lot of disturbance because of the problem happen inside the prostate here. Okay, so this is the main function we can see clearly. So the position of the prostate is quite low. It's not as what you thought is in a very high position. Okay, actually is in between our rectum, okay, and then the penis, okay, is slightly above there, only in between there. Okay, then this the testicle, and then this the muscle in between. Okay, so when people having this prostate problem, so doctor normally will use a finger to enter from the rectum, so to press the tissue over here, the muscle over here, to check whether there is enlargement on the prostate or not. Okay, so it's very close to your rectum. So if any problem happen, if you experience serious constipation or this problem, okay, it will affect the prostate also. So long-term constipation, the absorption of all these toxin or toxic things, okay, all the high toxicity in this area might affect your prostate. Okay, so if you have long-term constipation, maybe okay, you will affecting your prostate to have problem also. So on the other hand, if you have enlargement of a prostate gland, sometimes it will cause constipation too. Okay, so they are related. And then of course, if there is enlargement, then you might have facing problem in the producing of your semen, and then the ejection of what we call the sperm they call the liquid fraction of this semen okay, will have some problem. So the lubrication and nutrition for the sperm will have problem, and then you might facing problem in fertility okay, that means infertility will happen, okay, to a man. And then sometimes it might cause some inflammation in the urination tract also. And even sometimes the what we call uh, they call what the ejaculation, okay. uh, okay, so ejaculation, okay, the ejaculation will be affected, and then this will affect how the function of your sexual performance also, okay. So the main function of the prostate gland, okay, in summary, is to helping to produce semen, okay, closing the urethra during ejaculation, okay, so that to make sure the sperm can be ejaculate out, okay, strongly, and then without the flowing back is happening it won't allow the flowing back to happen. And then hormone metabolism, okay, a lot of hormone reaction will be happen inside your prostate also, okay. So the those androgen, okay, and then what we call the uh, hormone from your testicle, okay, it might affect all the hormone circulation secretion of this what we call the prostate also, okay. So prostate, sometimes the problems of my because of the okay, what we call the effect of some of the hormone or release, okay, those androgen and what we call the testosterone testosterone from your testicle there, okay, when they didn't release nicely it affect the cells in the prostate, and then sometimes it might lead to enlargement, growing of or abnormal growth of the cells inside your prostate, okay, and then it cause a problem. So these are some of the symptoms of prostate problems, okay. Normally you have a poor this bladder control. That's why mostly we will see those picture or all this cartoon indicate when men have this kind of problem, okay, the urine cannot flow cannot flow nicely, and then you will go very frequent bathroom, okay, you have to go to bathroom very frequent, because normally you feel the urgency for urinary, but sometimes with only a very small amount of urine, okay, you feel you want to go for urine already, okay, but okay, when you reach there, you urine, then you find out the amount of urine is very less, okay. And then sometimes some people when they start want to urine, then they have to wait for a very long time for the urine to come out, okay. Difficulty starting the urine stream, or sometimes stopping and starting the stream while urinating okay. That means after you start urine, then suddenly you want to stop it, or you feel you cannot control it, okay. And then some people, they might have the strength of the urine is very low, okay. It's not that good, okay, very close to your leg sometimes they say, and then the urine like dripping, okay. A weak or thin urine stream, okay, might happen, okay. And then you take a longer time to finish, okay, your urine. And then some cartoon or even will show 10 people come and urine, 9 people only left the bowl, but you are still there. Okay, these are the symptoms of prostate problems. Okay, the urination, poor bladder control will start to happen, and then in some cases, there will be frequent urgency, okay, urinary urgency, but a frequent bathroom, but very little and small amount of urine. Some might have a more serious problem on the prostate gland, and then cause the control of urine have some problem on the muscle, okay, and the contraction, and then the holding of urination, and then they might face difficult, okay, to control, okay, urine, and then they will find that once they have the urgency, the need, want to go for toilet, but they cannot wait until they reach the toilet, or they already piss in their pen there, okay, and then this, and then of course because of this urination problem, it's not that smooth, okay, and then I think someone okay, might forgot to mute their voice. I can hear someone talking there. Okay, and then because of the urine, sometimes cannot be clear, okay, fully, empty your bladder successfully, and then the growth of bacteria will easily happen in your bladder, in your this prostate, and then sometimes even in the urethra, okay, which the flow, the growth of all these bacteria might infect the system, and then the infection might happen, and then inflammation will happen, and then affect either your urethra, and then the what we call the prostate itself, and then the bladder also, okay, and then inflammation happen, and then it will cause pain when you urine, and then sometimes it will enlargement will happen, and then you can't go for toilet, okay, you can't urine, this kind of problem will happen also, okay. There's the symptom of prostate, and then some of the bacteria infection. So common prostate problems in men include these, basically there will be three, even though here show 4 types, but there are basically 3 types. Okay, one is what we call the benign prostatic hyperplasia, okay, the enlargement, the growth of the tissue in the this prostate gland, but it's benign, okay, it's just abnormal growth, okay, but it's benign, it's not cancerous, okay. And then the other type, okay, the growth is due to either chronic bacterial prostatitis, okay, this is due to just now what I mentioned, the growth of bacteria inside there, then it lead to infection, and then inflammation, and cause, okay, the expansion, inflammation happen inside the gland. And then the other types is the chronic prostatitis, which is due to non-bacterial one. Okay, for example, like those people, normally they stand, they always stand, and then, or some people, they have a very long seat all the time, okay, and then the flow of the blood flow in the body is not that good, okay. Blood is flowing to the lower part of the abdomen, more, and then it flow back very slow, and then it cause pressure, like for those who are standing all the times, for example, like a cook, okay, who are cooking, they have to stand all the time. Sales people near the counter there, they have to stand all the time, then it will give her pressure, okay, to the prostate gland, and then the flow of the blood to the lower part of the body, okay, due to a poor, okay, blood circulation, or maybe sometimes some other problem cause the flow of the blood to the lower part of the body is more, and then the flowing back is not that good. So this will cause a pressure to the this prostate gland, and then it will cause blood to accumulate and then accelerate in the gland there, and then cause inflammation also. Okay, and then this will cause uh, chronic prostatitis, okay, which is non-bacterial effect. And then this have to be reduced by going to improve the blood circulation, and then by having some exercise, okay, and then do not sit or stand for too long, okay, exchange and then moving, okay, so that to allow the fluid, okay, and then the blood to flow better in the body, not only the blood itself, sometimes your lymph is also very important. Okay, and then the third type is what we call the prostate cancer, which becomes more very common nowadays among the men. Of course, cancer cell is growing, okay, in the gland there, okay, in the prostate gland, and then it slowly block the tube from your bladder, okay, to sometimes it will affect the flow of the urine, and then cause urination to become a very difficult. Okay, so the abnormal, what we call this is carcinogen. Okay, this is cancer cell. Okay, so for those who are having abnormal growth of cells inside the gland, they have to go for further checking by doctor, okay, and then go for a biopsy test to make sure the abnormal growth is benign, or actually cancer is cancerous or not, okay, is carcinogen or not. Okay, so a normal enlarge of prostate doesn't mean definitely you're getting a cancer, okay, because if the tissue, the growth is benign one, it won't suddenly become a cancer cells. Okay, cancer cells is very what we call carcinogen and attacking, and then the growing is very fast, and then it will tend to destroy the tissue nearby, where the all the cells nearby are very fast. Okay, and then it will run here and there also. Okay, that is called carcinogen. So if it's a benign, okay, then you can be more, you don't have to be too worried. Okay, normally doctor will advise you to wait and see the growth. Okay, and then by using some going for some medication, she can improve, okay, and then to depress the growth of the tumor, or of the this abnormal growth inside the prostate or not. Okay, if until a certain stage when it need to be operated, or it need to be taken away, then doctor might consider doing operation on that. So you still have time, or even though if you have enlarged and not and benign situation, or you don't have to be too worried that it will turn into cancer. It will be a very, very slow, and then sometimes it won't grow into cancer cells. Okay, so you still can do a lot of things to control it, or to suppress the growth, okay, of all this tissue inside there. Okay, so okay, this is the risk factor. Okay, normally when it grows into prostate cancer, as far as we know, all kinds of bad lifestyle, like smoking, okay, drinking, all this all will affect, okay, and then the cells, okay, will the free radical is high in the body, okay, family history, okay, free radical attack, and then oxidation is happening on in the cells, and inflammation is happening all the times, damage of cell, and what we call the damage of cell DNA. Okay, this cytopathy is happening, low cell energy, low immune. Okay, and then hormone imbalance. All this is a risk factor to progress to produce okay slowly from normal, okay, cells, or slowly it will grow into an abnormal cancer cells, which is carcinogen. Okay, and normally it will take a quite a long period, and it can be prevented. There are so many risk factor here. We can see that especially like our bad lifestyle, okay, which will produce a free radical, and then and attack our cells, then oxidation happen, inflammation happen, and long term to have this kind of condition, and then slowly your cells will be DNA will be damaged, and then the damage of DNA might cause this what we call abnormal, okay, cells, and then this abnormal cell or cytopathy might happen, and then when all these are low cells energy, low cells immune, okay, and then finally the cells the abnormal cell will grow higher and higher, and then it develops into prostate cancer. Okay, so this is how it grows. Okay, so normally our this prostate gland a fear of these 7 things. Okay, number 1 is what we call the pressure, not the pressure from psychological side and physical side. Okay, especially just now what we say too long of sitting, too long of standing, and then very poor circulation, blood circulation, all this pressure will give to your prostate, and then it will make the prostate blood circulation, and then the cells to slowly damage, and then cause a problem in a later stage when you go older. Okay, and then number 2, okay, very low temperature. Testicle normally is afraid of heat. Okay, when it's too hot, your testicle the release hormone, all those testosterone hormone from men will be affected sometimes when the heat is too high. But for prostate, it is afraid of cold when the weather is too cold. Okay, and then what we call the prostate turns cool, the weather turns cooler, the excitability of the sympathetic nerves of the human body will increase, which will cause the prostate glands to contract. Okay, the gland, okay, ducts and blood vessels to dilate, causing chronic congestion and aggravating the stagnation of prostate fluid. Okay, that means too cold, sometimes the fluid produced by the gland, okay, cannot flow nicely. Okay, and then it become thicker, and then sometimes it will stuck there, and then it will stuck the flow of all this semen. Okay, when when having sex, it cannot be ejaculate smoothly, and then in the long term it will block, okay, and then it will get those stuck inside the gland there, and then it will affect all the cells there. And then number 3, afraid of holding back of urine, this kind of action. Okay, so that means when you want to you have the feeling of want to urine. Okay, so make sure how you go and urine quickly and not be told. Okay, for example, uh, some kind of jobs, or when you start, let's say when you meet customer, okay, yeah, in sale, you start your explanation and then you take you for some time. For example, when I'm giving a talk, okay, maybe it would take me 1.5 hours. So before I start the talk, normally I will have to go for urine first, because during the time I can't have the time, okay, to go for toilet. Okay, so it's not a lot. I have to holding back if I feel to I want to go for urine. Okay, because during a lot of talking I will feel thirsty very fast, and then I'll drink quite a lot of water, and then maybe, okay, you will have in a short. Okay, so holding back will happen. Okay, and then the lower segment of the male urethra is parasitic with bacteria. So when urinating, this bacteria will be washed away one, and often holding the urine will cause the bacteria to retrograde back to urethra, and then causing prostatitis. Okay, the growth of this bacteria will be higher. Okay, and then it causes inflammation. Okay, so number 4, actually the prostate cells also afraid of alcohol when you get drunk. Okay, because of the stimulation of alcohol, these capillaries will rapidly dilate, and hyperemia in the prostate. So at this time, the bloated prostate will invade the space of the urethra, and then the nerves around the prostate will be oppressed, okay, and restrained. It takes 3 to 5 days for the prostate to recover after being drunk. Okay, so if you regularly get drunk one, okay, so your prostate will be seriously affected, and in long term, okay, and then the blockage might happen, okay, and then uh, the abnormal growth and enlargement of the prostate may happen, okay, because of that. Number 5, okay, smoking, of course. Of course, as far as we know, smoking contain a lot of chemical, okay, and then so those people who are smoking one, okay, smoker is 1 to 2 times higher chances of getting prostate problem than those who are non-smokers. Okay, this is because tobacco contains more than 1,200 kinds of compounds, which mostly are harmful to humans. Okay, mainly nicotine, okay, cyanide, and carbon monoxide. Okay, the more you smoke, the more harmful your prostate is. Okay, number 6, spicy food. Okay, so those who like to take a lot of spicy food, okay, it may affect your prostate also, because excessive spicy food can stimulate the prostate and urethra, which may induce acute prostatitis or aggravate the symptoms of chronic prostatitis. To be careful a bit also, okay, it will lead to problem also. And then number 7, okay, worried too much of sex, okay, and then no sex, okay, also will give some problem to the okay, function of the prostate, okay, gland, or indulgent in the is the big enemy of the prostate. Too frequent sex can cause this hyperemia of the prostate and lead to this prostate what we call induced prostatitis. So excessive suppression of sexual desire will also cause a large accumulation of prostate fluid or induce inflammation. Okay, so to suppress on this sexual life so that the accumulation of this prostate fluid is too much is no good also. But of course, the body will automatically release some of the prostate fluid automatically even though the men didn't going through this sexual activity. Okay, so in addition in breakthrough excretion or frequent masturbation can cause congestion and swelling of the prostate and cause inflammation too. Okay, too frequent, and then this masturbation will cause inflammation to happen in that's why we can see sometimes nowadays the problem of this prostate is getting is happening in very young in the youngest group of people also. Okay, and then one of the reason is because of this problem of masturbation also. So we have to really take care, because the muscle contraction, all those will lead to will give some impact on the prostate gland. And then if it happens too frequent, it will affect the gland. So how to improve and prevent the prostate problem? So from what I have explained so far, you might have a very clear picture on what is the function of our prostate, and then how it works to the contraction of this gland will control the flow of the urine, and then the ejaculation of the sperm, semen, have to be done, but with the help of the this prostate, the muscle at the back there. And then that's why it's very important to do something in the early stage, when there is still in good condition and not what we call the preventive action is always better than curing it. Don't wait until you feel you experience all those symptoms like difficult to piss, urination is weak, control of bladder start to have problem, and then the what we call the strength of the urination, and then the ejaculation of your sperm is not that smooth or difficult. Only then you start to really find that or maybe there's some problem with your prostate, and then want to do some improvement on that. So preventive is all the times many times are better. And then if you can look into certain points and do something in your daily lifestyle change, and then give some steps, and then do some necessary things to prevent it, it will be better, and then it will prolong, and then maybe you might not have this kind of deteriorate on the muscle, on the function of the prostate, and then you will live happily until very old age without having this kind of problem. Because for those who are having this kind of what we call the prostate problem, normally they also affect their sleeping pattern very much also, because they have to wake up many times at night, because a frequent bathroom will happen. Then every time they urine they urine a little bit out only, and then very frequent, very a little bit in the bladder there they will feel like want to urine again, and then go to the toilet again. And then when they go to toilet, sometimes they have to wait a very long time for the urine to go through. The flow is not as smooth, okay, and then it's quite embarrassing, okay. Sometimes they will face and then of course in the long term it will seriously affect quality of sleep, and then affect emotionally affecting, and then sometimes, okay, it will lead to other problems like emotional problem, okay. This insomnia, all this problem, okay, in the later stage. So in the early stage, if we can prevent it, better we do something to prevent it. Okay, so here in Vantros, okay, healing ministry, okay, so far we recommend, okay, the use of IM laser and then the CV8, okay, to help, okay. It will give you a very good preventive action, okay, in prevent it. Okay, so we can see what are the major things you have to take into consideration when we want to prevent, okay, and then improve for those who already have this prostate problem. Okay, number one, okay, we must make sure we will have smooth blood circulation. Okay, just now we have already mentioned there is one type of inflammation which is caused not because of bacterial effect, because of pressure, because of poor circulation one. So a very smooth blood circulation, okay, especially in the lower abdomen part the lower organs, they need a good flow back of blood, okay, so that the flow of the blood in all these organs is very nice, and then the exchange of oxygen and then nutrient and the waste flushing out of the waste can be carried in a very smooth way because of a very good blood circulation. Okay, so as far as we know, the use of IM laser will give you a very, very good effect on this. I will later on explain to you. And of course, CV will contain some of the phytochemical which are very good in improving the viscosity of your blood also, and that will lead to a better blood circulation also. Okay, and then number two, of course, just now we already mentioned free radical produced inside the body, which will cause the oxidation or the attack. Oxidation happen in the cells, and then which will cause damage to the cell's DNA, okay, and then cause the function of the cells cannot be carried out nicely, and then sometimes it will cause, it will lead to a low production of energy inside the cells as well, okay, and then oxidation will happen, and then in the long term it will lead to what we call damage of cells to happen, and then damage of DNA, and then it lead to a growing of abnormal cell in the body, okay, and then this in long term will produce not only damage abnormal growth, and then it will go to cancer also, okay, carcinogen cells will growing, okay. So number three, okay, in order to strengthen and then to give to make sure our cells are more energetic, we have to provide a well-balanced nutrient to the body, okay, to make sure the creation and then the energy produced by the cells are strengthened, are enhanced. So the use of CV8, which will produce a complete nutrient, or especially the essential fatty acid, essential amino acid, all kinds of vitamins and nutrient, these minerals, okay, which will provide a very balanced nutrient to not only for the gland, okay, for the prostate, but all the cells are in the body. Okay, and then fourth, okay, it will help, okay, to provide a very good sleep quality. Okay, we need good quality of sleep. Okay, in order to have good quality, okay, we need to have a very balanced hormone. Okay, and then balance this nervous system, stable nervous system. So all these two systems, they need a very balanced nutrient to nourish all the cells there. And then we use a very good mechanism of photon, okay, to strengthen, enhance the production of all the energy in the cells of your nervous system and then all your gland, so that how to produce a very stable nervous system and a very stable release of your balance. So the communication, okay, between all the cells, all your organs and your brain and your system will be connected nicely with a very strong balanced hormone and stable nervous system. And as well, so far we knew that the prostate is a gland which will produce all kinds of hormone also. So the balance hormone is very important because the prostate gland will be affected by the testicle, which will produce all the androgen also. Okay, so all these hormone will affect the release, okay, of this prostate gland. Okay, those semen produced by the gland. Okay, so beside that, of course, we find that if you want to focus on improving your prostate, maybe you have to have some appropriate muscle training on the lower part of the abdomen also, which I will tell you in the okay, as follow. Okay, so these are basically some of the foods, okay, that you need when in your 3 meals. Okay, we encourage you to take more because it contains all types of vitamin, beta carotene, okay, and then convert to vitamin A, and then some of the phytochemical in carrot, okay, and then in this didn't translate into English. I don't know how we call it. This 肥菜. Okay, and then number 3, you all go ahead and find out what is the name of this veggie idea. Okay, which is very good for normally we use a lot in the dumpling. Okay, from this not east of east not east of China. They used to do all this dumpling. Will put a lot of this veggie one, very smelly one, and then it's very strong for sexual. You will improve sexual performance. Okay, and then third is the pumpkin seed. Okay, and then pumpkin as well, of course, because it contains very high minerals, especially zinc. Okay, which is very good for the protection. Okay, the maintenance of what we call the prostate. And then it contains all kinds of nutrient and all kinds of what we call the minerals and vitamin also, which will help a lot in making the sperms, okay, and then making the semen, all those excretion of hormone, okay, in the prostate there. Okay, number 4 is garlic. So garlic, as far as we know, it contains a lot of ingredient which is very good in killing bacteria. Okay, so to avoid inflammation happening because of the urinary tract, okay, which normally, okay, will contain the growth of all kinds of bacteria there. And then this taking garlic will help a lot in prevent, and then it contain all kinds of antioxidant also. Okay, and then some of the these bee products, okay, bee pollen, okay, these honey, okay, it will contain some of the ingredient which will help in the all these hormone balancing. And then number 6, we encourage you to take more this kiwi fruit also, contain very high vitamins, okay, especially vitamin C, okay, which is a very good antioxidant also. Okay, but for those who are not good in cooking, who didn't really take all this food in your 3 meals, okay, don't worry, because CBA will contain all these ingredients that I've already mentioned, and then CBA also a very very strong antioxidant, this health food supplement, okay, and then it contains all kinds of vitamin and minerals, especially like zinc also it contains very high, and then it contains also all the phytochemicals derived from wild ginseng, and then another 3 types of ingredient, the cypaton, the aronia berry, and then pomegranate fruits. Okay, I will let you know some of the ingredient that it contains later. So here you can see, maybe I will suggest you will be good if you can practice some of this exercise to strengthen, okay, the muscle on the lower abdominal part. Okay, there is the coupler pose, which is the number 1. Normally I will encourage in the morning that you will, after you go for a walk, or maybe when you wake up in the morning, then you can do some of this exercise. Or some people, they might prefer to do in the evening. Okay, that's up to you. Or some people, they might do a few of this exercise before, maybe half an hour before they go for bed. Okay, so you will improve, or is a stretching and then breathing technique, or you can join in together also, so to relax your mind, to relax your muscle, and to improve, okay, your lower part, your pelvic, okay, can be strengthened also, so the flow of your lower part, or the blood circulation can be improved also. So you can do some of this pose, and then sometimes even without only very slow stress like this will improve the blood circulation. And then maybe you can combine with the use of IM laser when you do all the exercise. Okay, so from here you can see the second is your hero pose. Okay, of course we will encourage, or at least the second stage, the first one is just is a sitting pose, and then the second type is slightly backward, okay, on a sitting pose, and then the third will be backward lying down, okay, which will give a very strong contraction on the abdominal. And then number 3, recycling big toe pose, okay, which will be depends on your ability, or either you just do a recycling by going for 90 degree, or if for a while flex toe and point toes, okay, when you do it, okay, and then for 20 or 30 times, okay, or if you can do better, okay, can stretch better, then you can go for the second one, there's holding on the toe there, and then stretch further to your chest, or then the stretch on the thigh there will be bigger, okay, strengthening. Okay, and then number 4, head to knee. Okay, this is very normal pose, or either forward or sideward, okay, on head to knee pose, so you can stress all the muscle on both side of the abdominal, okay, so strengthen the muscle there, okay. And then the fifth is the bow pose, which is the most important in improving your pelvic and your back, okay. And then number 6, of course, the pelvic pose. Then this is the most important pose that you can practice. Sometimes even you didn't do other pose, then you just focus on pelvic pose also can. Maybe you can go for a few holding there for maybe maybe 30 minutes, 30 seconds up to 1 minute, and then you repeat or do that for 10 for one round, okay. And then it will be very good for your pelvic position, and then your lower back, and then your spine there, your back pain, okay, also can be improved. These are the exercise that you can do. And then when you use IM laser, we will encourage, okay, to use the IM laser on the lower part of the abdomen, okay. There is beginning from your this belly button. There are actually 5 points, okay, 4 points from this 中极, okay, the lower part, the lowest part, okay, very close to your this sex organ, okay. And then there is your 5 fingers, okay, below your belly buttons already, the pose, okay. And there is called your 中极, and then the second one is called the 关元, okay. There is 4 fingers, and then 2 fingers below is called the 气海, and then your belly button. So you have, maybe if we are using IM laser, we have to use for 2 rounds, because the IM laser, the light cannot cover so many points one together. You have to go for 2 times, okay. This, so just let you know, the most important point to affect the prostate is this point, the 中极, okay. And then all this, it will okay, give a very good effect, and then it will affect the what we call the prostate also, because it will help your bladder, and then it will help your kidney also, okay, all this point. So for kidneys, okay, we will put on the 气海, and then the 神阙, and then at the back of this 神阙, okay, normally we will put at the back also, that is for, okay, the improvement on your kidney, okay. And then for prostate one, the major part normally we will do here, okay, these two, okay. And then at the bottom, in between the okay, in between the sex organ and the rectum there, okay, in between there is another point we call the 会阴, okay. And then this is the point which directly point, okay, to your this prostate. And then so for improvement of prostate, this is a very important, directly will give effect to your prostate one. So maybe you can sometimes put the watch here, and then put the line, okay, the point to here, okay, and then give a very strong impact on the point here, the 会阴, for maybe 3 or 5 minutes, okay. And then see whether it will give a better, stronger, okay, effect on the prostate, okay. This using the theory of what we call the acupuncture, okay. So how IM laser work to improve the blood circulation, actually I've explained many times, but here I still want to give a brief, very short explanation on what is IM laser, okay. But IM laser is basically the combination of 3-in-1 integrative medical device. Remember, it's a medical device and certified by FDA, okay. It's a medical device, it's not simply a health device, is a medical device, okay, officially certified by FDA. This certified, okay, as a medical device 12B, okay, which is good for improving our health and safe to use by all the family, the whole family member, and it won't give you any type of a side effect. So the safety wise can be protected because of all this recognition. So it's 3-in-1. Number one, we are using the theory of light. So you can see from here all kinds of this cert we have, and then is well known use the light therapy in NASA, in this Olympic Council, okay, and then is a 3B medical device or certified by FDA and IEC, okay, can be safely used. And this is not a new invention, is already created almost 40 over years and study of the use of it for more than 50 years, okay, and then by all these well-known worldwide famous university, you can easily go and search in the net the use of laser light therapy, low-level laser therapy, or the history, and then the medical journal published by all these institute and universities study. Okay, you can easily get and then they have published so many books, and then the medical study on all this. You can get from our agent if you like, okay, to have a further refer on the use and then the effectiveness of the use of the light, and then the study of biostimulation. Okay, so this is the basic use of light, okay, in the body. There's the light actually based on the sunlight, the spectrum of the light, the red light, okay, which is 650 nanometer, and described by the scientists the light of life, okay, which they find that this wavelength of light will give a very good impact and then effect on the induce and trigger the function of the enzyme activity inside the body, and then eventually will help a lot, okay, in the reaction and then the chemical reaction in the production of energy in the cells. So by using the light, okay, which contain the photon, okay, the red light 650 nanometer. This is the structure of the molecule of the photon. It will look like this. The use of this photon, it will give effect on our cells, and then will activate the function of all kinds of enzyme inside the body and increase the enzyme activity in the body, and eventually give very good effect in cleansing our blood. Okay, and then secondly, okay, so number one, you use the light and then use the laser to penetrate into our body, so that the photon will attach on the blood cells and then will travel through the blood circulation and then distributed to the cells, to the whole body, the cells inside the whole body. And then secondly, just now we have already mentioned the theory of acupuncture, okay, and then we have specially designed, there's a line coming out, okay, and then it acts as a light needle to replace the needle normally used by acupuncturists to do the acupuncture, where they have to use the needle to poke in, okay, the invasion, which normally if you are not a doctor, you are not allowed to do. So the creation of the light, which is also or a type of energy, and then it can penetrate into the body. So by using all the acupuncture point and penetrate all the light, all the energy to the acupuncture point, then eventually we can push, okay, we can easily activate, okay, all these acupuncture point and increase the flow of the qi and the blood, okay, what we call the qi xue xunhuan. The flow of the blood and the qi will be accelerate and then increase, and then the flow will be better, and then what we call the meridian system in the body, which control the qi, the flow of the qi will be enhanced, and then will be what we call the get through, because from the belief of Chinese tradition way of treatment, okay, pain, okay, when the meridian is not working smoothly, pain will happen when your qi meridian system is not working smoothly. So when we can, okay, make the meridian qi system flow through smoothly, then the pain will go away. Okay, so by using the light needle, we can access from point to point, and then make the 361 acupuncture points and meridian of the human body to work smoothly. And on the middle of the word watch, there is another laser head which will point on the wrist there, okay, the Neiguan Xue, which is the heart meridian. Is a very, very important, very strong, and then a common acupuncture point, which will help all kinds of illness in the body. And then you can use the whole watch as a few acupuncture point to work together. Sometimes you maybe you can place the whole watches, okay, on the neck or on the spine, or and then maybe on the just now what we mentioned for the prostate, okay, in the abdominal there, okay, the front part, okay, or we call the ren mai, those acupuncture one you want to activate one, which will bring good effect to your prostate gland, okay, in the meridian system. Okay, so thirdly, okay, the watch, okay, also will act as a magnetic therapy also, okay, because it contains a magnet. Even though you didn't on it, by just wearing on the wrist there, okay, you will give magnetic therapy, and then create magnetic field, okay, to the cells or inside the body. And then the magnetic therapy are a way of a treatment normally carried out by this Eastern this meridian this Oriental therapy to treat pain, okay, to improve immune system, to depression, and then there are a lot of books menu coming out on the study of this, and then they have been carried out for many thousand years, okay, and then you can just by wearing it on your wrist or even without on your also, it will give you a very good effect, improving your blood circulation, reduce inflammation, and then improve help to reduce pain, okay, and then the discomfort due to stiffness or this. Okay, so from here, okay, overall, the use of IM laser will give you a very good the photon go in, it will help to improve the activity of the enzyme, and then finally it will cleanse the blood cell and make the blood cell to opens up. So this blood test normally will carry out before using IM laser. Okay, you will see all the blood cells or cannot all the this electron is not functioning well in the blood cells. So blood cell will clump together. It will look like this. Okay, all joined together, and then it looks like the pig intestine, which will affect the flow of the blood cells, and then affect the delivery of oxygen and then the nutrient, okay, to the cells. Okay, after half an hour of using, you will see the effect of the light, okay, on the cleansing, okay, of the blood cells, so that the blood cells electron can function properly, and then it will bounce back, and it won't join together, and then it will flow very fast. So it will make your blood circulation to flow better, carry the oxygen better, okay, and then distribute the nutrient better to your whole body cells. And then second, all these light will be distributed to the cells and enter to the cells, and then in the cells there, your mitochondria, okay, a kind of enzyme in the mitochondria there, we call the cytochrome oxidase, will be activated by the light, also by the photon. This the natural design of human body, so that the photon, the daylight, when we expose to it or in the sunlight, now we the light, okay, the photon. So when enter and reach the cells, reach the mitochondria, it will activate the enzyme activity in the mitochondria here. So the bio stimulation action will happen in your mitochondria. Okay, so the mitochondria will make use of the oxygen, water, nutrient that we supply to the cells, and then by going through the biostimulation, okay, and then photo biostimulation, then it will create, okay, it will turn all this nutrient, water, and then oxygen into energy form, okay, which we call the ATP. Okay, and then in the process, it also produce another substances we call the nitric oxide, which is very strong in cleansing the blood cell, in improving the viscosity of the blood, and then the elasticity of the vessel. Okay, so nitric oxide is very important, okay, in the body. Very sorry, the dog is barking outside. Okay, so the ATP, the growing of the ATP is the key, the generate energy for the cells, so that to protect and then to improve the mechanism of metabolic of the cells. So the cells will do their function better if the ATP, the energy is higher in the cells there. Okay, so this is very, very important in the function of all the cells. So by providing the photon, it will give a very good help, okay, in promoting the generating of ATP. And then with the help of all the nutrient provided by the CVA, of course, we are giving all kinds of nutrient to all types of cells in the body to generate, okay, their energy. So we can see here, so the activate of cell function will happen, then all types of cell in the body will be activated, and then they will perform better. So you can see the neuron also contain neuron cells, okay, our white blood cells. Of course, only our red blood cell didn't have any mitochondria inside, it won't be activated to have more energy, okay, inside by producing ATP. But it can be improved by the charge of the photon, by strengthen the neutron or the electron in the blood cells itself. So our bone cells, our skin cells, and then our all kinds of cells, our heart, liver, okay, it will be improved, okay, by providing sufficient light, okay, the photon to the cells, the generation of ATP will be higher, and then it will use the nutrient, waters, the photon, okay, to promote the activity of the mitochondria and generate more energy. Okay, so your function of the cells will be better. Of course, all these cells form the organs, okay, inside the body, and then the organ function can carry out better also. And then all these organs will coordinate with all the tissue, all the nervous system, hormone instruction. Okay, they will work hand in hand and form all the system inside the body. So with a proper organs function, a better hormone release, a higher this stable nervous system. So all the function of the body is in a very strong harmony and balance activity is happening. Then your body can of course function nicely, and then it can carry out their function effectively. Especially you can sleep better, and during night time when you sleep nicely, your healing power, your inner doctor can carry out your healing system to repair your body in a better way. So the repair, restore, and then the regenerate of the cells inside the body will be better. Okay, so in the process of this, you see that all this system will function, okay, will coordinate and then function in a better way. And then the inner doctor, so normally we call your healing power. Some people, they might say, this is your immune system, but it's not true. This not also, it's not your healing power alone. So normally we describe the center one, we call this is the inner doctor. Okay, so this is the doctor who know your whole body the best. Okay, and then he will control all the system in the body. Okay, and then if all this system have very strong, okay, what we call the energy level is very strong. Okay, so the combination of all this system, and then all your psychological power, okay, your inner power will be increased, and then your healing power, and then your repair system will be better, because your inner doctor will control everything, so you can sleep better, and then the release of the growth hormone to restore, repair your damaged cells will be carried out better, and the use of all your what we call the stem cells will be monitored by your inner doctor better, and then it can be used in a more effective way by the coordination of the human growth factor produced by normally by your liver, or in the regenerating of new cells inside the body. Okay, so by having a very strong inner doctor, of course, all this coordination will be in a better, okay, and balance your whole body system. Okay, so that's why we say IM Laser is not only a device which can help only to cleanse your blood, to make your repair yourself. It can actually in overall, okay, effect, okay, on your whole body actually. Okay, from your cells, okay, repair of cell, regenerate of cell, restore your cells function, to okay, slowly improve all the organs function, and then improve all your digestion, and then improve all the absorption of your nutrient, and then slowly repair the cells to regenerate, and then give you a better sleep. Okay, and then coming down all your nervous system, and improve balance your hormone release, and then the whole body will have a better what we call the healing during a good sleep, and then repair the whole body system, and then eventually produce new cells to replace all those old cells, all those damaged cells can be repaired during the night with the help of your stem cells inside the body, and then eventually all the cells inside the body will have sufficient ATP, okay, to bring you a more energetic performance. You will feel the vitality from the inside, and then the improvement of all the uh, organ system, and then we call the improvement cell healing from the inner happening, and then it enhance and strengthening all the function of all kinds of system in the body, and then eventually you'll be more energetic from, and then you feel the vitality, and then slowly it will eventually change, okay, all your skin, all your feeling, and then your blood circulation, and then from the outer, you will find that you will look younger, and then uh, the skin texture will be improved, okay, and then maybe the pigmentation will go away, to your all the fine line in your face, on your face, will slowly go away, okay, and then you improve, okay, or in your eyesight, okay, your hair, okay, maybe will turn black back, and then all this are the improvement of the secretion of the some of the hormone, and then the improvement of the blood circulation on the delivery of the nutrient to all the cells. For example, the growing of your gray hair, all this, or loss of hair, and then all this of because of all kinds of nutrient cannot be distributed because of poor blood circulation, and sometimes nutrient is insufficient, and sometimes because of imbalance of hormone secretion, which lead to all this problem. So by balancing it, you will give a very, very strong effect. So by using IM laser alone, it can help to improve egg type or egg system of the body, and 8 major body system, and bring you 80 types of health benefit to all the health issue can be improved. Okay, so from here we can see IM laser, what we need in improving antioxidant, okay, improving your blood circulation, and then providing a better blood circulation to improve the distribution of oxygen and nutrient to your body, and then it improve to provide you a better sleep, and then emotionally give you a balanced hormone which will improve, okay, your sleep also, and then your emotion control, sometimes by releasing a good hormone in balanced hormone, it will give you a better mood, okay, and improve your whole body. And then of course by providing a better energy level to your cells, okay, to all the muscle, okay, you will have a better energetic, more strength to do carry out some muscle train on improving the muscle inside in your body. Okay, long-term use of IM laser, of course, it will in a certain way, okay, to improve the growth of all these muscle cell. Of course, it can't replace the exercise in building up muscle one. Okay, just let you know. But in terms of blood circulation, it will help you a lot, even though if you are not exercising also. Okay, so in terms of all the nutrients and special ingredient to improve the strength, and then to repair, and then to provide strong antioxidant to help to protect our cells, okay, from the attack of all this free radical, or on the generating of all kinds of in the process of repair of all kinds of cells. Okay, so CV8 provide you with all the nutrient that the body needs. So CV8 basically produced by this CVMGR, which is a research institute, okay, with the coordination between the China Academy of Science, Vantros, and then this Plantel from Korea, an institute on this plant stem cells research center, okay, and then Sydney University, okay, Australia, okay. So they joined together and then they formulated this product we call the CV8, which using a lot of technique from this Plantel, a very high technique and then very new technique which they have discovered and they have developed, okay, and successfully to what we call to filter out the stem cell lively from this wild ginseng of Korea, okay, which is 80 years old wild ginseng, very rare wild ginseng, and then they replicate and then they reproduce to make the stem cell to produce all the phytochemical of the wild ginseng, and then in a mass production, and then can produce all those very rare ginseng, and then the ginseng oxide, and then the phytochemical in the wild ginseng to make it into the raw material for health food products and in medical use. Okay, so we are lucky to be able to cooperate with Plantel, because Plantel, the technique, okay, the the technology they have created have already been patented in almost 86 countries in the world. Okay, so this is a technique, okay, very new, and then the first and the only one, okay, right now, okay, for the past 160 years. A lot of people trying to do that, but they are cannot fulfill it. But now actually this Plantel, so you can see all the facility they have is very advanced one. Okay, so now using this technique, they are able to successfully filter out the stem cells from the wild ginseng, and then from the stem cells they are able to preserve it and then replicate and then further produce all the phytochemical in a mass production and in a very stable and consistent way, and mass production and high content of phytochemical can be produced in the process. So you can see here, this in the plant there, how you can see all this tank. So every tank, they are derived from one stem cell of one this wild ginseng, and then they can produce to equivalent to 75,000 okay pieces of wild ginseng. Those phytochemical can be produced from 75,000 pieces of this wild ginseng. So wild ginseng, all the while we know the benefit is very good, but because of the value, and then it's very difficult to find, and then it takes a very long time to produce all these very old wild ginseng, so that it can have the ability to produce all the very important, very rare ginseng oxide inside that. Okay, so we are able, okay, to take all these wild ginseng and then very old ginseng all the while only those emperor, okay, those very powerful men in the world they can consume, or even some business, a very rich man also very difficult to get, but not only because of the cost, or because one pieces of this wild ginseng, okay, and then old one, or maybe 30-40 years, or some like ours one, we are using an 80 years wild ginseng, which have certified by Korean, they got a certified body. Okay, So all these are, they have to grow, okay, even though we already have the technique, okay, to grow, to plant and then grow it in the wild uh, uh, forest, okay. So it will eventually become something like wild ginseng, but it will take you many years also. So for those ginseng that we are taking, okay, not the expensive one, also very expensive, okay. Normally they are growing in such a way, or maybe for 10 years, then the price will be very high already. Some cheaper one maybe 5 or 6 years. So very difficult for us to get wild ginseng, which is 20, 30 years, and then it will cost you 100,000. Those of 50, 60, 70 years, maybe few 100,000. Okay, maybe some I see by auction it will go up to million also. Okay, so by having this technique nowadays, we can filter out the stem cell from this wild ginseng, and then we can produce it. Okay, so this is a very, very good technique, and then from this technique we are able to maintain all other different species of plant, which is very rare and they're very difficult to get. We can maintain in such a way also, and then we can through a better study to help them to produce all those phytochemical inside all these very rare plant species, just like what we have done to the wild ginseng. They have successfully, okay, find out of the way, okay, how to further replicate and then make it how to reproduce, okay, all those phytochemical, so that one tank of this will produce equivalent to 75,000 pieces those phytochemicals. So these are the very rare and valuable phytochemical. Normally it will bring very strong effect into the body. These are the ginseng noside, RG3, PH3, APPD, and then RG5, all contained in this what we call the CVA, okay, and then all these RG3, PH3, okay, RG5, they are very strong in improving blood circulation, okay, improving our liver function, okay, and strengthening our immune system, and especially in anti cancer, and then in slow down the process of aging, or improving the brain activity, so to slow down those dementia problem, or improving the blood and preventing all this Parkinson, okay, and then helping improve all types of inflammation, and then all the brain function. Okay, so it contains also this RH2 and then RK1, which are very strong in helping diabetic, okay, and then inflammation, okay, and then provide a very to stabilize the brain function and help in the hormone balancing of all those good hormone. And then beside that, it also contain all the essential fatty acid, okay, and then the nutrient that we need in response of this antibody, okay, and then the DHA, okay, and then the EPA, okay, all these very good, okay, omega, okay, also it contains, and then it all the OPC phytochemicals, which are very strong in anti-aging, antioxidant, okay, very strong in improving our immune system, okay. So these are the our other substances, And the CVA also combined with the use of Sipaton also contain very, very good nutrient inside it, like 190 types of omega, okay, all the phytochemicals, omega 3, 6, 7, 9, okay, and then all the nutrient, essential fatty acid, essential amino acid like tryptophan, okay, which will help in sleeping, and then all the vitamin A, C, E, D, K, all this, okay, all the minerals, calcium, magnesium, iron, potassium, okay, manganese, all this, okay, which are very helpful in the especially in our nervous system or neuron cells, and then it provides all the beta carotene, okay, and then selenium, all the okay, flavonoid, okay, and then it's very good in anti-aging, improving immune system, protecting the heart, and improving our nervous system, reducing the glucose, and then improving the production of this cholesterol, and then improve, okay, the use and then the activity of our stem cells inside the body. Okay, so aronia berry, okay, of course, is the king of the berry, contain all kinds of antioxidant property inside, very good for the blood circulation, the blood vessel, okay, and then improve stomach, okay, injured, okay, and then protect heart tissue, and then improve, okay, protect the DNA, improve for repair, and then give good benefit in the repair of the DNA, and then it protect the liver, and then okay, improve the overall, okay, function of the body, and then finally the pomegranate, okay, will provide not only in the taste, and then it provide all the vitamin C, all the vitamins, and then it's a very good antioxidant property also, okay, anti-aging, and then anti-inflammation, especially for those joint pain, okay, it will give you a very good effect on that, okay, and then it will give, okay, protective action to your heart, and then to all the system. So with the combination of all kinds of nutrient, and then the effect of all the ginseng oxide, okay, we can easily have this effect of super strong antioxidant I've already mentioned earlier, and then these the some of the testing have been carried out on the CVA, on the improvement or on the DNA, okay, the use, okay, when the split of the cells, normally the DNA will be affected, okay, the shortening of the you know how we call this one, okay, in the DNA there, okay, but eventually when it's split for too many times, it will become shorter and shorter, and finally it will stop split, and then the cell will die off, okay. So replenish, okay, the thing that it needs, so that it will slow down, okay, the use of the DNA here, okay, so that it still can split in many times, and then prolong, okay, the life of the cells, okay, the deterioration of the cells. So ginseng oxide is able to help in this way. So eventually it can give a longer period, okay, delay the self life, okay, especially nowadays we are facing problem of premature aging, and then we die in the age of 70 something, because the cells cannot be split off again, because the early shortage, okay, in the DNA there, okay, we cannot split further, and then we cannot live anymore. But by right, okay, in normal, the cells can be split until the age of 125 years old. So the replenishment of the nutrient and then the ginseng oxide can help in this way, the DNA side. Okay, so help improve overall immunity. So DNA the ginseng oxide and then the IM laser can activate the production of the energy of the white blood cells, and then improve the function of all your livers, okay, in the what we call cleansing of the blood, or this, and then you improve the making of blood cells, okay, especially the white blood cell, also NK blood cells, okay, can be improved, and then it will give you overall immunity improvement. Okay, so anti-cancer effect, just I already mentioned, or the ginseng oxide, and then the especially IM laser in the healing process, it can improve the energy of all the healthy cell, okay, and then improve the function of the white blood cell, okay, and then it will help a lot in the process of healing after all the treatment carried out by the doctor, like chemo, okay, like operation. So after that the process of recovery, okay, you can take CVA in terms of supplement of all kinds of nutrient, and then all these antioxidant property, anti-cancer property, you can use IM laser to speed up the process of healing also. Okay, number 4. Okay, so we just now already mentioned the coordination, the improvement of your hormone and then your neuron system will make sure the whole body system can work in a balance and improve, and then promote sleep, and then this eventually will improve cell repair ability. Okay, and then the function of your liver, okay, balance your blood sugar can be improved in a better way by providing all this ginseng oxide, and then a better hormone release and increase repair of the cells in your pancreas, okay, which will increase, okay, the secretion of insulin, and then the repair of the cells on the resistant, okay, and eventually it will have a better control of your blood sugar, okay, and improve your diabetic condition. And then number 6, of course, the cleansing of your blood cells to make your blood flow better, improve blood quality, and then it repair the use of IM laser, the nitric oxide, and then all the nutrients that provide necessary, like Q10, all those are contained in the CVA, okay, will improve the elasticity of blood vessel and then increase the blood flow, so oxygen and nutrient can be delivered more effectively. So this what we have seen in all the customer, they have using IM laser for a period, they will see very amazing and very obvious, okay, foreseeable, noticeable improvement in the blood circulation. So number 7, the ginseng oxide, okay, the ginseng stem cells will eventually, and with the help of the light, will promote the growth factor, enhance stem cell function, okay, accelerate the repair and reproduction of our cells, and the use of our own stem cell can be improved, can be activated by the help of the light and the CVA. Okay, so finally, okay, if you want, okay, because you can improve from your inner slowly, it will affect the performance from the outer part also, your skin will be improved. But if you want to further improve in a very short time, you can take our this serum, CMC serum 2, which provide you with a stem cell of wild ginseng together with all the amino acid that the skin cells that it needs, and then some of the nutrient that our skin needs, and then to fight against pigmentation, to take away this pigmentation and brightening the skin of the face, and then eventually will provide you will give you a very bright and then full of blood flow, okay, and then very firm, okay, muscle on the face, and taking away all the pigmentation, all the fine line, and then the wrinkle will disappear, and then it will give you a very good healthy and very beautiful from the outside, okay, and then in the long term eventually will improve in your body shape or those also, okay. So from inner health to your outside of your beauty can be improved by the use of the combination of IM laser, CBA, and serums. Okay, so regaining youth is not a dream. Okay, after using for a period, definitely you regain your youth. You look younger, 5 years, 10 years, and from here, beginning when you are still young, or you start using, then you prolong. Okay, the life of your cells, and then you slow down the process of aging, okay, and then you look younger, okay, even maybe after 20 years, maybe you will look still the same, okay, and then regaining your youth is not a dream. Create a brand new you, okay, from inside health to external appearance, no longer a dream, okay. So I share up to here. Okay, leave some time for you all to okay, to if you have any question on this, okay, you can raise some question on here. I can help, okay, uh, to answer. Okay, thank you very much.
Yeah.
Oh,
Thank you,
okay,
Mr. Lee.
thank you. Just
Does
now
anybody
this
have some questions?
just now somebody mentioned to me there is spring onion okay. Maybe I thought that is definitely called what we this is called spring onion. I I call garlic I say garlic just now actually it's spring onion. Actually both also will help in our body. So any question?
Any questions? Can raise up the hand in chat. Can unmute you.
So I hope everyone from today onwards you really know what is the function of prostate. Okay, otherwise people saying got problem on prostate, or you just but actually you don't know what is the function of prostate. Okay, only for men, or you only know that it will affect maybe your sex performance, and then it will affect your urination, and then you are ashamed to tell people when you are having the kind of symptoms, but you eventually uh, basically you don't know, okay, what is the function of prostate. Okay, that is by right, that is our responsibility, okay, to know the function of our organs one So remember okay, so the prostate not only it will affect your the control of the urine, okay, and then it will seriously affect the during the reproduction the intercourse, and then the lubrication of your sperm, to make sure the sperm can live longer in the vagina, and then the process of meeting the eggs, the chances will be higher, and the fertilizing will be successfully, okay, and then you will get your son and your daughter. Okay. So from here, I can see George, Joseph. Is it Joseph? Joseph, is it this
No, it's not me.
not you.
John, Ronnie.
Joseph is not Rebecca's husband. No,
No, it's Josh. Josh.
George. Okay, so Josh, I met you before or not? Josh. Okay, normally we will post, but actually I have suggested to Michelle, maybe we won't post so fast, because we find that a lot of people, because the rapid posting make them don't want to join the meeting, don't want to waste the time, and then they just waiting for the repost of the things, and then they start to listen back. We feel that sometimes we need some of the leader and then some of the people who are interested, at least to learn on the spot, and then to bring up some question. If you really study and then learning on it, maybe you can bring up some question also, which will be helpful to all people who are attending the class one. Okay, and then don't rely on the posting, and then finally there's no people coming to the 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 web line, the help talk, got no people to come. When I talk also, I don't feel get excited also. Okay, then it won't be in a very good cycle, because as far as we know in direct selling, if all this seminar is conducted, okay, not on the net okay, those days when we conduct a seminar, and then all this health talk, and then the training, maybe some of the leaders, they have to attend by paying, and then they have to travel to go to a place. And we, during that time, we also mentioned that, okay, the success of a leader, they have to encourage more people to learn, to study, to be better, okay, in terms of selling their products, the knowledge they gained. That is the basics in the success of doing direct selling, okay, and not based on the sales only. Okay, we have to base on the people, how many people who are attending, who are learning. There is the signal of whether you can produce a very big group who are really active in the field one. Okay, nowadays, because of the improvement, but okay, we still need, okay, the spirit to be there, especially all the leader, okay, who are in, okay, this line, okay, they have to lead by example. Okay, they have to be more disciplined, okay, because how many people are studying, how many people are learning is the key point of whether you can success in direct selling or not. Okay, that's what I can share. That's why I told Michelle, maybe we won't post it up so fast. Okay, maybe after 1 or 2 days, okay, I will post it up. Okay, okay, so I hope everybody. Yeah.
Regarding the laser on the layer part, which we prefer, frequency 3 or frequency 4?
Okay, I don't get you. You means how to use
target treatment
target
for
treatment.
target treatment.
Intensity.
Intensity,
Okay, so target treatment normally we will use 4 bar. So just now I already mentioned where is the point. Okay, so if you want to do the target treatment, so you would do the 中级 and then the what we call the lower part one. Okay, and then there are 4 acupuncture point, which is helpful. If normal acupuncturist, they will put four together on the point one. Okay, there is your belly, near your belly button, and down the qi hai, the guan yuan, and then the zhong ji, this 4 point one. Okay, but for us normally, because the 4 point very wide, if you put the watch there, I don't think you can cover the 4 point altogether in one shot. Okay, so normally you have to do 2 times one. Okay, so I will emphasize more on the lower part, the 2 points. That means the 5 finger and then the 4 finger one, the 中极 and then the 官员, and then the 会阴 there's the in between. There is the actual point for this prostate one. If acupuncturist they will put on. There's the 会阴 or there's the testicle and then the rectum there, in between there the center, that point. Okay, so if you really want to do like target like this acupuncture point, you can try lah. Otherwise, normally we use on our wrist and then our this nose there. Okay, and then we'll try to put on the abdominal. Okay, which is a nearer side. Okay, to let all the photon to distribute to all the cells inside this area. And then because using the qi, the meridian theory, that's why we use the hui yin. Okay, that is according to the meridian practice lah. Okay, not the cells theory already. Okay, okay.
Okay.
Okay, any other question? Okay, I still got one a little bit of time. Okay, maybe 5 minutes for you to ask. Okay, if no question, that means
Any more questions?
regularly for the whole day and turn in on every 2 hours.
Basically,
Okay.
Yeah,
Can
okay.
we? Yeah. Is it this Francis Chai is asking?
Yeah,
Can we?
Yeah.
Can we wear the IM laser on our wrist regularly? Is it your question? For the whole day and turn it on every 2 hours? Yes. Okay, but of course, normally we encourage you to wear on your wrist, without on it also the magnetic therapy will be on, okay, all the times, okay, which will help to improve your blood circulation also. Okay, so every 2 hours I will advise you to use it. Of course, first of all, remember to use 2 times on the nose. Okay, that is our routine, our standard use on the wrist and the nose. And then other times I will encourage you to use for not more than 6 times in total. Okay, there's another 4 times, maybe you can do some targeting lah, all this. Okay, and then if you are talking about every 2 hours, or because sometimes it might be over. Okay, 2 hours, every 2 hours, that means 12 hours or already 6 times. So one day maybe before you sleep, you will sleep 8 hours, and then the rest will be another 16 hours, of which will be 8 times already. Okay, I think it will be too much one sometimes. Okay, I normally will encourage you to use not more than 6 times. Okay, it wouldn't give you a better result even though you give more times, because sometimes why we call it the low density light, because we don't want it to be too much also inside the body, and then we want it to have the bio effect will do, and then the absorption of the light, the distribution by your red blood cell is limited also. Sometimes it won't be effective even though if you give a very high dosage on the use. Okay, it won't give you a better result one sometimes. Sometimes you will be too excited also. Okay, and then give you some problem in sleeping, of those cannot sleep well one. Okay.
Okay, thank you, Mr. Lee.
Okay.
And any more other questions?
I think there's no more question. Okay, I think no more question just for today. Okay.
Thank you, Mr. Lee.
Thank you,
Yeah.
Mr. Lee.
Thank you, Sam.
Okay.
Thank you, Mr. Lee, and thank you,
Yeah.
Sam.
Okay,
Good night.
Good
Good
Thank you,
night.
everyone. Sam, thank you. See you.
Okay, bye bye.
Okay, come tomorrow, go can Cantonese.
Vô con. Tomorrow
So
we'll have a Chinese Cantonese session 10 o'clock. For those who are interested, can still log in at this ID. Okay. So see you. Bye bye. Good
See you,
night.
everybody. Good night.
Bye, everybody. Good night, Sam. Good night, Mr. Lee.
Good night.
Good night. Okay, Sam, you can just end the meeting. Sam, you can end the meeting. Thank you.